Chapter 2, Lecture 3, The Production of Good Health. In this section, we introduce the production function of good health. Production function in economics tells us how the level of output changes on various level of inputs. So, in this case, a health production function indicates the maximum amount of health that an individual can generate from a specific set of inputs in a given period of time. So we need to know what are the inputs, health-related inputs, that can affect the level of output, health output for us. So the factors, health-related inputs, are in the right-hand side. Mathematically, we can see that in a mathematical terms, we can see these actually the dependent variables, which is health production in the left hand side, and the right hand side we have all the inputs, the health related inputs that they can increase or decrease health outcomes. So we have the profile of the individual, which means the mental and physical status of the individual, basically status of health. And then technology, which refers to the medical technology, basically. And environment, which refers to the air and water quality, which you agree that they are affecting the health outcomes of individual. And social and economic status, based on profession, income, and level of education. These are the factors affecting the production of health. And lifestyle, depends on how you actually live, how basically you your way of diet or your exercise, if you're following a healthy lifestyle or very unhealthy lifestyle, that affects your health production. And also level of medical care, that we talked about that in previous chapter, that is all the goods and services included in this medical care. This is basically all the physicians, nurses, psychiatrists, dentists, and so those are the services. And then the medical goods such as dental floss, surgical table, surgical basically bed. These are all medical care that we wanted to know, basically based on the level of input, how we can change the level of output, our health output, health production. So we talked about that environment, the quality of water and air and demographic factors, and all these factors and medical care, they can actually change the level of health outcomes. So if you wanted to graphically show that, in the horizontal axis we have the amount of input medical care, and then in the vertical axis we put the total health production, basically. And we look at the, how by increasing the amount of medical care, we can increase the total production in health. So in this graph, graphically, we can't actually look at more than a relationship between two variables. So we are assuming all else being equal means that in this graph, you're assuming the individual profile, basically lifestyle, and then environment and technology and everything else basically being equal. And then we are changing the amount of medical care, and then we are looking at the production of the health, and we see that this relationship, the total product by change in the medical care increase, but it is not a straight line. It is bowed again, means that it is increasing in a decreasing rate, similar to the diminishing marginal utility we had. And remember that this is assuming that we are changing medical care, one of the inputs of health production, and looking at the amount of total health produced. And we are assuming all else being equal. So we have a movement along the curve by change of one of the input, which is the medical care, and looking at the total change in the total health output. So mathematically, we can show that the marginal product of medical care is increasing in the decreasing rate. Basically, the marginal product is diminishing by each additional amount of medical care. So incremental improvement in health brought about by each successive unit of medical care consumed, that's the marginal product of medical care. And we see that marginal product of medical care is equal to the marginal product of last unit of medical care, basically by medical care services consumed, and this is the marginal productivity of health. So each additional health produced by additional unit of medical care, it's called marginal productivity of health. And we see this, there is a law of diminishing marginal productivity, which is actually applied for all the level of production for all goods and services. Marginal product of medical care diminishes as the individual acquires more medical care. So marginal product care negatively sloped, similar to the marginal utility, diminishing marginal utility. So if we have the medical care in the horizontal axis, the amount of medical care in the horizontal axis, and instead of total product, if we put the marginal product, we see there is a downward sloping actually shape for marginal productivity of medical care, as well as marginal productivity for any other products and services. Basically, this concept applies for any production level, basically. It's when we are keeping all else being equal. So, changing any one of health-related inputs in the production function alters the position of the total product curve. So it means that shifts or rotates. Now, So far, we assume that we are keeping all else being equal, means that all the other factors rather than medical care is assumed is constant. But what if all the other factors one by one changed? So we are changing one by one. So, for example, so any of those other factors, other inputs that we mentioned before, profile, lifestyle, environment, technology, those are going to shift or rotate our production care because the marginal productivity of medical care has changed in response to the change in the other factors. So what does it mean? For example, if we have a new medical technology, so in that case, with the new technology, with the introduction of the new drugs or any innovative medical and surgical procedures, or say that use of computer supported information system, so these are going to shift our production up in each unit. With each unit of input we can produce more. So the new medical technology results in treatment expansion and treatment substitution. So if you wanted to show that graphically, this upward or rotation of the total productivity of health shows that at each level of input of medical care, we will have higher level of output with rotation, upward rotation of total productivity from TP0 to TP1. And why is rotation is not a shift, parallel shift? Because the interception here, I forgot to mention that the interception, it depends on the individual profile, age, gender, and then genetic factor, basically ethnic and racial background. So we are assuming that, so those are changing in different example, but right now we are changing one by one. Let's say that this time is changing technology, improvement in technology, new innovative, actually drug or health devices, rotating our total production from TP0 to TP1 means that at each level of medical care, we will have higher total productivity of health. So the changing from A to B shows the higher basically productivity of treatment, and the shifting A to C shows that um, basically we a cost saving of healthcare service resources. We need lower medical care to produce the same amount of health with the lower amount of medical care. So this is the case when health technology make our health production more cost saving. So we talked about the movement from point A to B and movement from A to C. Now, what happens if there is a change in profile variable? Remember, so that which depends on person's genetic makeup, mental state, age, gender, and race, ethnicity as of a given point in time. This affects the intercept term. We talked about that, and a slope of the health production function. So if we have a say that the person has a genetic case of cancer in family, and the person developed cancer, in that case we have a downward shift or rotation of the total product curve that causes the marginal product curve for medical services to shift to the left. So when we have downward um, uh, basically shift, in that case, at each level of Medicare input use, we have lower amount of um, health production. So in that case, similarly, if nothing actually changed, and because of the age effect, basically our profile depreciate, and this rate of depreciation basically may be different, of course. We talked about that. It's different from individual to individual, and in that case, by aging, um, we have the shift and rotation in the marginal productivity. Personal habit impact the production of health, or adoption of the healthier lifestyle cause the total production curve to shift and rotate upward. So if you change your lifestyle to healthier lifestyle, you shift your production, health production basically upward. And if you change your personal habit or lifestyle habit to the worse, then you shift that basically downward. So what about the improved socioeconomic conditions? So improve in socioeconomic condition, increase the intercept term, and marginal productivity basically moves up. So an educated individual is more efficient, so we can actually produce with the same amount of Medicare more health. So the total product curve shifts upward. What about the socioeconomic condition? Reverse effect, such as say that health influences education, of course. For example, poor health conditions during the childhood may result in a less healthy adult with moderate level of education. So what does it mean here is the Fudge argues that the acquisition of education and health depends on the value people place on future events. What does it mean? It means that if you have a basically if you don't have a good health, and therefore you don't expect to live long enough to have a positive rate of return for your investment in your education, you don't invest in education. In some poor countries, very poor countries, it's not cost effective to invest in education, because you don't live long enough to get a positive rate of return for an investment in education. So that's why there is a basically reverse effect of health influences on education. That's how it works. And there are actually other than socioeconomic condition, as we mentioned, affecting the health outcomes, of course. But there is a direct effect of income, and there is an indirect impact on health as well. So So what does it mean? It means that sometimes you may consume more medical care. So do you think more educated people, they're healthier, they have healthier lifestyle, and mm, basically they live in a safer environment with the better quality of the air and water, basically. So they have a better health. So therefore, here there is an indirect impact on health, means that um, so um, you when you are living in a basically better environment, so your health productions are better. So this is obvious. Some of the things are very obvious. um, the factor is in economics is important, is the impact of income. In economics, we say that relative income or relative prices matters. Means that your income, uh, it matters, depends on where you live, it depends on your neighborhood. For example, mm, at this time, with the current neighborhood, your income may be on average, um, and you don't basically feel bad. But if you move to the Beverly Hills, say that with the same amount of income, um, of course, basically say that adjusted for the standard of living, still you're poor compared to your neighbors, and that feeling makes you feel bad. So an individual absolute income is positively related to health, but then relative income matters. Relative income or deprivation, the deprivation of hypothesis says that that is affecting your health as well. So income inequality is an important factor besides the absolute income. And then we talked about the environment effect. Um, so um, so so far, basically, we talked about all the some of the important factors that usually in research healthcare services we control, um, and we look at the impact of those inputs on the healthcare production. Um, in the next section, we talk about the empirical studies, how they are affecting our health production.